Hi, I'm Dr. Terry Magruder, and today we're going to discuss asthma basics, understanding disease process and disease control. Today we'll discuss the scope of asthma disease burden and its implications for individuals and communities. We'll also discuss asthma disease process, including asthma symptoms and recognition of asthma exacerbations. We will also discuss what good asthma control looks like and learn new strategies for communicating this to families. The asthma disease burden. Asthma is a very common chronic disease. It affects a little over 11% of all children living in families with incomes below the federal poverty level. It is also more common in minority population, which creates health disparities related to asthma outcomes. It is very costly from a public health perspective. It costs the U.S. about $56 billion annually to care for asthma. On a more personal level, it is a leading cause of missed school days and missed work days, which results in immediate financial implications for families caring for children with asthma. Additionally, on a more personal level, approximately 9 people will die every day in the U.S. from asthma. It is very common for children with asthma to seek emergency room care, which is very costly and time-consuming for families. Additionally, 3 out of 5 individuals with asthma limit their physical activity, which puts them at risk for other comorbid conditions that can exacerbate their symptoms. What is asthma? Asthma is a chronic inflammatory condition of the airways, and this inflammation causes swelling, which leads to asthma symptoms. It is a chronic condition, and long-term, those symptoms may change over time. Swelling in the airways narrows the space for air to move in and out of the lungs, making it difficult to breathe. The airways of children with asthma are more sensitive and tend to overreact when they come in contact with a trigger or during an upper respiratory infection, causing them to become more swollen and inflamed. This process leads to asthma symptoms. We will discuss triggers in another education module. What are common asthma symptoms? The most common asthma symptoms include cough. It's especially common during sleep or at night or with physical activity. Some patients may have wheezing, chest tightness, or shortness of breath. You do not have to have all these symptoms to have asthma. Some children have more prominent cough symptoms versus wheezing. Additionally, younger children do not often understand what chest tightness or shortness of breath is, so often will complain of abdominal pain, back pain related to these symptoms. Families are often best at identifying signs and symptoms in their children when they are having asthma symptoms, especially in younger children. They'll notice a decreased activity level or wanting to sleep more. What happens during an asthma exacerbation or a flare-up? On the left, you'll see a normal bronchial tube. It is open like a pipe. On the left, you'll see a bronchial tube of an asthma patient. You'll notice that on the right side, the muscles around the airways tighten. The swelling in the airways increase, making the walls thicker, and mucus increases and builds up. This is really common to the analogy of a pipe versus a straw. The normal bronchial tube is open like a pipe. In an asthmatic bronchial tube, their airways are more narrow and produce more mucus, and oftentimes that narrowing creates the wheezing sound that we hear during asthma symptoms. What are 2 types of asthma? There's intermittent asthma and more persistent asthma. Patients that have intermittent asthma rarely have symptoms. They only occasionally have airway swelling and narrowing. Most children with intermittent asthma will only have quick relief medicine to treat their asthma symptoms. However, children with more persistent asthma, they have some level of airway swelling and narrowing present every day, which requires more chronic medications and daily controller medications to control their asthma. More frequent symptoms and asthma flare-ups are much more common in children with persistent asthma. We will discuss asthma medications in another education module. It is very important to recognize that every child with asthma is different. What medication works for one child does not often work for another child. So it is important for them to seek care at their healthcare provider to obtain treatment to manage their specific disease needs. What are the keys to asthma success and long-term management? The goal of asthma control and management is really to decrease airway inflammation and improve daily quality of life. Less airway swelling and narrowing typically results in fewer symptoms, fewer flare-ups, and better disease control and better day-to-day living. What does well-controlled asthma look like? Children are symptom-free most days and not using quick relief medicines more than 2 times a week for symptoms. The exception of this is children that pre-treat before physical activity with bronchodilators. That is part of their standard therapy and should not be accounted for in terms of using extra albuterol during the week. Children are symptom-free during sleep. Children are not often missing school or daycare because of asthma symptoms. Children with well-controlled asthma have fewer urgent care visits to the doctor or emergency room for asthma symptoms. Children with asthma should be able to exercise and play with their peers. It is a really important goal of asthma management. It is very common for families to restrict physical activity in their children due to exercise being a trigger for their asthma. But long-term goals of asthma therapy is to optimize physical activity, as it is important for all children, including those with asthma. Thank you for joining us for this presentation of Asthma Basics. Please join us for additional asthma trainings, including asthma medications and asthma action plans, asthma triggers and environmental assessments, and keys to a successful asthma home visit.